This is my client Amy, and she flew in from Florida.
Orlando, yeah.
And came to the Hesch Institute in Aurora, Colorado. And I thought I'd have her share her experience, why she chose Hesch Institute and what her experience was.
Sure. I flew in from Orlando, and I had read about Jerry and Hesch Institute online, probably off and on over the last year or year and a half. I've seen a lot of practitioners for, I guess, trouble that started in my low back, maybe SI joints and glute, and has moved to the front, and has been debilitating at times. This just seemed like the next step. So I did watch a lot of the YouTube videos first before I came out here, and you come out here a little bit nervous, but it was definitely worth the trip. I've spent 3 days with Jerry, and I have to say, like, your evaluation has been continuous over the course of 3 days. Like, I feel like it's been very comprehensive, and I appreciate that you've spent a lot of time basically peeling back layers and looking for, I guess, looking for any sort of hidden culprits that might be causing pain or restriction. I'm leaving here with, I feel better, number one. Number two, I'm leaving with a lot of tips and instruction for self-treatment at home, which I really appreciate. So
Good.
It's been a really, really good experience.
Thank you for that. And we treated your left ankle.
Yes, you did.
All the way up.
What you treated, yes. There's
And
the left ankle.
And treated all the way up to where your head and neck connect.
Yeah, absolutely. Absolutely.
So Hesch's method is a whole body approach.
Which I appreciate, and that's where I had kind of been stuck. I told you when I came out here, I've seen a lot of practitioners over the years, probably over 10, 12, 13 years. Massage therapists, rolfers, multiple chiropractors on a very regular basis, Nuka chiropractor, lots of physical therapists. I've used PRI therapy that I got
Postural restoration.
Postural restoration, and it did help me to a point. Maybe to the point where I could feel like I have restrictions or I'm stuck, and why is that? And that's why I came out here, and I feel like you've answered a lot of that.
And on the first day, we posted those films separately.
Yes.
And it was interesting because your pubic joint was shifted inferiorly on the right, mm-hmm. and your left scapula was elevated, and you had had treatment for that with the postural therapy.
Sure, yes.
And correcting the pubic joint induced symmetry of your scapula. So it's really interesting how the whole body is integrated, and sometimes you have to treat away from the apparent problem.
That's totally true, and that's a big reason why I came here, because it didn't feel like it was just one place that was stuck. It felt like a lot of things weren't really working correctly. So I hope going forward that that's going to be different.
And then lastly, you had a very interesting response to me mobilizing the first rib just to the outside of your neck.
Yeah, and that's up here, which was funny, but I felt, you'd first worked up higher, and then my first rib, and both times I felt on the table, like my right front and back, like hip flexor and thigh and abdomen, like everything just kind of jerked and released on its own in a positive way, but it was completely involuntary, and it was funny how your work here just impacted what was going on down here.
And you now know how to mobilize that rib yourself.
I do.
Very good. Any other comments?
I don't think so. It's been a positive experience. I hope you'll tell me if you come to Orlando.
I will. I'll let you know.
Okay.
Thanks so much.